our screening may not have the level of data we would like, but prevention actually has a really good track record. There is one thing that unambiguously could prevent the most head and neck cancer, which is smoking cessation. Smoking cessation is easier said than done. It is very, very hard to quit smoking and to stay off of it. Nicotine in tobacco is now felt to be more addictive than heroin. So how to do this is very, very hard, and the subject of a conversation another day. But for our purposes, this is unambiguously a critical thing to do. The other thing that really makes a difference is HPV vaccination. HPV-driven head and neck cancer is caused by the same strains that cause cervical cancer and other HPV-driven cancers, and the vaccines against HPV cover these. It's an unfortunate failure of marketing that these vaccines were marketed as STD prevention in, frankly, a relatively puritanical country. Their more important function is as cancer prevention. They prevent cervical cancer, they prevent head and neck cancer, and they probably prevent other HPV-driven cancers as well. When this epidemic of HPV cancers peak entirely depends on what the ongoing rate of vaccination is. But I will tell you that I have 3 daughters. I love them very much. And despite intention to remain in complete denial about any future romantic activity on their part, I intend to vaccinate them at a young age, several years before the typical onset of such activities in this country. Alcohol, for those of us who like a glass or 2 of wine at night, the data on alcohol is unfortunate. The cardiac preventative benefits that were once believed have really fallen by the wayside. It seems to just not be true. And the data on alcohol influencing cancer risk, not only head and neck cancer, but breast cancer, colorectal cancer, and others, unfortunately keeps on getting worse. And so alcohol moderation or cessation is something that can be considered for those who wish to reduce their cancer risk. And I realize that this is not applicable in all places in the world, particularly not Chapel Hill, North Carolina, where I speak to you from. But there are a lot of people in India and a lot of betel nut chewing, and it does cause cancer. So reduction in use or cessation can help prevent cancer. Now, a common question I'm asked for patients is, what about this, that, and the other supplement? I wish that there were good data to suggest it could help. I would love to recommend a vitamin to reduce people's cancer risk and let them go on as they like. The problem is that it's been tried many times, and we have a graveyard of negative trials for chemo prevention with the use of various supplements. There are some studies ongoing with targets of high interest. I highlight for a few. This is not a recommendation to use these for prevention, but simply as information that these are things being looked at. Green tea, polyphenol E, luteolin, resveratrol, and very expensively immunotherapy are of interest and being studied. And if I can conclude on one thought, or maybe 1 or 2 quick thoughts, yes, I highly endorse cancer screening. This should be done regularly in dentist's office and primary care offices. But the really key thing is smoking cessation and vaccination against HPV. I thank you, and on the Grace Forum, I'm happy to answer any questions that anyone might have.